Get your HIV medicine via drone delivery. That's the plan in Uganda, where this pilot program is being trialled around Lake Victoria. It delivers HIV drugs from a hospital to patients in rural hamlets in Kalangala, an 84-island archipelago. If successful, it may be adopted on a larger scale to help to improve delivery of drugs and medical supplies for Uganda's public healthcare system, which faces understaffing and shortages of basic medicines and supplies. Project coordinator Joan Akulo explains the challenges she's faced in the past.
I personally have also been here in Kalangala for the last 4 years. Had also faced a lot of challenges to the point of almost drowning in water. So the drones project was actually brought to Kalangala to overcome the geographical challenges that are faced by the health workers together with the patients, mostly HIV positive patients.
The trial is funded by pharmaceutical company Johnson & Johnson and run by the government-run Infectious Diseases Institute. The drones can fly in winds of up to 15 meters per second and in heavy rain, although the research team is restricting this to 5 meters per second and light and medium rain to be safe. Other African countries like Ghana and Rwanda are already using drones to improve healthcare delivery. This trial program will last until June, when it will be assessed. It's only delivering antiretrovirals for now. But Rosalind Parks-Ratanshi, director of the Academy for Health Innovation, says that could change.
We also are looking at putting other things in the drone. Because the drone lands, it can be loaded with samples. So maybe we can test for HIV viral load, maybe we can look at TB samples. We're also starting to look at COVID samples in the West Nile region.